The Edo State Government has reaffirmed its commitment to eradicating drug abuse and trafficking of illicit substances through continuous awareness campaigns, sensitization programs, and community initiatives aimed at combating drug abuse in the state. Speaking during the 2026 International Day Against Drug Abuse and Illicit Trafficking, the Coordinator Office of the First Lady and Chairperson of the Edo State Drug Control Committee, Mrs. Edesili Okweolo Anani, noted that the theme of the event underscores the need for government and institutions to collaborate in addressing the evolving challenge of substance abuse and drug-related crimes. The First Lady expressed concern over the emergence of new psychoactive substances, citing the need for awareness campaigns as she urged members of the public to join hands in promoting healthy living.
This is not just timely, but crucial. It calls on us to reflect on the realities of a world that is continually gripping with the complexity of drug abuse and illicit trafficking. These challenges do not just affect individuals, but our families, communities, and the very fabric of our society. Every day, we see the devastating impact of drug abuse manifesting in rising crime rates, deteriorating health, and the overwhelming burden it places on our social service system. It's important to note that while we make progress, there's still so much work to be done to protect the most vulnerable among us, especially our youth and women, who are often the primary target of illicit drug trade. I call upon parents, teachers, non-governmental organizations, community leaders, health professionals, and members of the public to unite in our efforts. Together, we can build a comprehensive approach that eradicates drug trafficking and promotes health and wellness.
Commander of the National Drug Law Enforcement Agency, Edo State Command, Michel Ofoyeju, condemned substance abuse, describing it as a major challenge, and reiterated the need for sustained awareness campaigns and behavioral change initiatives to combat such vices.
The war against drug has been on for centuries. Notwithstanding the huge quantity of drugs that we intercept on a daily basis, a large number of people we arrest and prosecute, and the quantity of drugs we destroy, just as we did last week, the problem still persists. And this is because the demand side of the equation has stubbornly remained. So until people ask for drugs, stop asking for drugs, the trade will continue. If you are selling any product and you bring out your product morning, afternoon, evening, night, and nobody buys, you try that for 1 week, you'll be out of business. We need intelligence-led operations to smoke out those that are dealing in these dangerous substances. We cannot fight the 21st century battle with the 20th century weapons. We will practically fail. The NDLEA Edo State Command is committed to a paradigm shift. Our innovative response are three-pronged. Number one, prevention. We need preventive education in schools, in markets, and other places. We are actively working on a pilot scheme for alternative livelihood for repentant cannabis cultivators. In conclusion, the call to action is that the persistence of this problem is a call to our resilience. The new challenges are a call to our vigilance, while the innovative responses require our collaboration.
The Commissioner for Health, Dr. Cyril Oshomole, reaffirmed the state government's commitment to strengthening mental health services and offering rehabilitative agencies to reduce substance abuse and promote healthy living in Edo State.
Drug abuse is not merely a law enforcement issue, it is a major public health concern. It contributes to mental health disorders, violence, accidents, poor educational outcome, family breakdown, and loss of productivity. Our young people are particularly vulnerable, and their protection must remain a top priority. Under the leadership of Excellency Senator Monday Okpebholo, the Edo State Government remains committed to a comprehensive approach that combines prevention, treatment, rehabilitation, public education, and enforcement. We recognize that punishment alone of sending people to prison or Oko prison cannot solve the problem. We must also provide support, counseling, treatment, and opportunities for recovery and integration. As Commissioner for Health, I wish to reaffirm our commitment to strengthen mental health and substance abuse services across the state. We will continue to collaborate with NDLA, healthcare institutions, community leaders, faith-based organizations, schools, and civil society groups to ensure that those affected receive the help they need. I commend Brigadier General Bupa Manura and the NDLA for their tireless efforts in combating drug trafficking and protecting our communities.
The campaign aims at raising awareness concerning the risks of the use of illicit substances, as well as its harmful effects, while also mobilizing collective action towards building a healthier, drug-free Edo State. Olumide Abiodun Mudashiru, reporting for PFM Global News.